I'm here to talk to you about how to respond to health insurance companies when they deny claims. And I'm going to try to give you some tools that you can use on your own without a lawyer, but it's going to require a willingness on your part to play a little chess. So I'm a retired lawyer, and for 30 years, I fought every day against health insurance companies. And my technique was to change the power dynamic and put them on the defensive. And if they feel weaker, that's how they're going to settle and pay claims. So the dollar amount is not going to be significant enough to hire a lawyer. So I'm going to give you a toolbox with some tools, and it's all based on some legal regulations that have been on the books for 50 years, and they're never complied with. That's the little secret here. The game is to catch them in illegality, and they know that you know. So you have some hidden strength here. These rules are designed to help you deal with this situation. That's what they're there for. So I'm going to urge you to think about fighting back instead of feeling very defenseless and very frustrated. Whoop. All right, so what is this power that you have in the law? It's the power to demand things from them. To not just ask, but to demand things from them. And these rules apply to almost every health insurance plan in the country, and Medicare and Medicaid has similar procedures. So it's time to investigate them. Now, this all starts with some document called an explanation of benefits, EOB. You may have seen these. It doesn't say much of anything. It's vague. There's columns. The only thing that's clear is it says you have to pay the doctor this much money. And you're like, what? So you're in the dark, and to keep you in the dark is illegal. So what is it that it's supposed to say on this piece of paper? The specific reasons why they're denying your claim. Where in the insurance policy does it say they can do this? Actually, they have to tell you in the insurance policy, and if you appeal, what you need to give them and why they need it. I've never seen one of these things that comply with the law in 30 years. And they know that other people know it. So you got to get your hands on the actual one. You can't rely on the doctor's office telling you, hey, your insurance didn't pay. So you need to have this in hand. That's got to be the one that deals with these claims. Once you have it, what's your first chess move? You're going to demand two things. The first is all of their internal documents on your specific claim. And the second is this illegally withheld information, meaning, hey, what did you do this? Why did you do this? Does the insurance policy say you can do this? And also what you'd need for appeal. I've got to tell you, you got to do this in writing. Okay, a lot of people like to pick up the phone. It's not going to work. They're just going to customer service you to death. You need to have it in writing, so that puts pressure on them to respond in writing, and now you'll have a record of it. All right, what are the documents we're looking for? You're entitled to get documents that show what they received, what they looked at, what they were thinking about when they made the decision, and anything they created, like emails or memos. That's what we're gunning for. However, this gets really interesting. First, let me just say, why does these rules exist? Well, how can you properly appeal when you don't even know what you're appealing from? You don't even know why they denied the thing. So that's why these rules are giving you tools to go get information. Now you can target what the real issue is if you have all the information. Here's where it gets really interesting. Computers are processing and denying these things and not human beings often. So are they going to have any documents to give you? No. So what are they going to do? Send you a letter saying, our algorithm decided to not pay your doctor? They're not going to do that, right? So they have four choices. The first one is, pay this thing, hallelujah, it's done, we're happy. Or if they don't, they have three choices. Give you nothing, give you a little something, or give you everything you asked for. And depending upon what they do, we've got two different moves in our game of chess. So if they give you very little or nothing, you're going to say, hey, dudes, you never legally denied this claim within the 30 days. And I gave you a second bite of the apple, and you're still not telling me anything. Illegal, pay. And then your backup is in the dark trying to argue what you think you should argue. On the other hand, if they give you everything or a lot, now you can see if they made mistakes. Did they rely on the wrong information? Did they have the wrong documents? Did they misinterpret something? Now your chances of success are greatly increased because you have this information. So what happens if you don't win? You can do a second appeal. And the great thing is, the law says it's got to go to another person who's never had anything to do with this claim, a fresh set of eyes. And it's going to be a higher level person. And hopefully, here's the game now, they see this illegality and they're like, we need to get rid of this. Let's go pick on somebody else, and they pay. That's the game. So let's look at a real life example that shows why it's so important to demand and to get. So we had a widow with an $800,000 denied life insurance claim under her husband's policy. And they had to turn over these documents under the very same rules we're talking about here, right? Did they do it? Yes. And right on top was an email from the claims person to the boss. We have to pay this claim. Here are all the legal reasons. And he said, no, deny the claim. We had the email. The jig was up. What did they do? They sent her a check for $800,000. No lawsuit, no nothing, right? So what's the takeaway I want you to have here? I want you to feel like you're empowered. You have rules. You can demand documents. You can demand explanations. Can I guarantee you this is going to work? No, of course not. But I'll guarantee you one thing. If you don't try, you are going to be stuck with this claim denial. Thank you.